Hello, this is Dr. Leong. I'm a facial plastic surgeon in Pittsburgh, Pennsylvania. I wanted to take a few minutes and review once again in detail a patient who had a cosmetic rhinoplasty in my practice. Cosmetic rhinoplasty is a very, very common procedure. The essential priorities are always the same. We want to create a beautiful, harmonized appearance of the patient's nose in a way that sits comfortably in the context of the rest of her face. We also want to do it in such a fashion that the nose looks completely natural. We want our surgeries to be undetectable, not just immediately after the surgery, but even many, many years after the surgery. And we work very hard to make sure that the structure of the nose is sufficiently strong such that it will look natural. Of course, it goes without saying that we also want the nose to breathe well. All facial plastic surgeons are very well acquainted with the nasal airway. Facial plastic surgeons, all of us were otolaryngologists before we were facial plastic surgeons, so we have the best knowledge of sort of the nasal airway and the nasal physiology. So let's take a look at this very nice young woman, lovely woman who came in to our practice, and she had certain basic complaints. From the frontal view, she didn't like the bulbous nature of her tip, and she also didn't like her brow tip aesthetic lines. When you look from the lateral view, she didn't like the height of her dorsum. She had a bit of a dorsal hump. So taking a look first at the frontal view. When you compare the frontal view, you'll notice immediately that if you compare the tip in the before and after picture, you can see that the tip, it was not extremely bulbous, but there was some contours to the cartilage of her tip that gave the tip a little bit of a wide, a little bit of a bulbous appearance. And you can see in the after picture that the tip is much more harmonious. We're not trying to create a pointy tip or anything like that, but a tip that is elegant and fits with the rest of her nose. You'll also see, and this is an interesting, important subtlety, there's a concept called the brow tip aesthetic lines. And so the brow tip aesthetic lines are these lines that sweep down from the middle part of the brow in a nice gentle curve down to the tip of the nose. And if you compare in the before picture and the after picture, those brow tip aesthetic lines are a little bit disjointed, but when you look at the after picture, you can see there are two nice sweeping smooth lines. That is the hallmark of an elegant, beautiful nose. Now let's shift now to the lateral view, looking at this 90-degree angle. In the lateral view, her main concern far and away was, she didn't like this dorsal hump. It's not a huge dorsal hump, but it's not a small one. You would sort of call this perhaps a medium in a sense. And so you can see we've reduced that dorsal hump, that she now has a smooth dorsal surface to her nose. But very importantly, extremely importantly, it's not scooped out, it's not over aggressive in the approach that was taken to sculpting it. We see a lot of this coming into our office, people who had rhinoplasties years ago, and they're too scooped out. We never want the patient to be in a situation where they're just meeting somebody for the first time and somebody can sort of sense that they've had surgical work on their nose. She doesn't have that appearance, and one of the reasons is the dorsum is reduced appropriately but not excessively. Another incredibly important thing about that is by not excessively reducing the height of the dorsum, you make sure to preserve her breathing in a healthy way. You haven't really succeeded for the patient if the nose sort of looks cuter, but it doesn't breathe well. This is an extraordinarily important thing, and so when we do consultations for rhinoplasties, of course, we always look up with a fiber optic scope and examine all the anatomy inside. It's a very important thing that you should be sure that whoever you go to does, and do a proper fiber optic exam inside the nose before they go to the operating room to do a rhinoplasty. The anatomy on the inside of the nose is every bit as important as the anatomy on the outside of the nose. Again, looking on the lateral view, you can see that the projection of the nose, it's subtle, but the projection, which means how much the nose extends away from the face, has been brought in ever so slightly. When you reduce that height in the dorsum in the operating room during the case, you have to re-examine how the dorsum relates to the tip. And if you bring the dorsum down, you very often have to adjust the tip slightly to make sure that they harmonize with each other. The angle of the nose, meaning the angle of rotation, which is defined by the angle between the columella here and the philtrum here, has been increased ever so slightly. But a little bit of increased rotation made for a more elegant nasal tip. And then the very last thing, and this is super subtle, is the interface where the columella here met the philtrum. That angle where the nose meets the upper lip was made just a little bit crisper. These last 2 points, you'll note when you look at the pictures, are pretty subtle, but all these little subtleties add up to a more beautiful aesthetic result. So now, moving on to the last view, this is the view that I like to sit back when I'm looking at before and after pictures of rhinoplasty and make the assessment, does the nose sit harmoniously in the context of the face? If you look at this young patient, she's got beautiful eyes. You want the attention drawn to her eyes, the expression in her face overall, not sort of gazing at some sort of mild distraction that can take place when looking at her nose. And perhaps you'll agree that in the after picture, the nose sits harmoniously on the face. It's not distracted in any fashion by the anatomy of the nose. When we sort of finish up, what we really want, like I said at the beginning of the video, is a nose that's harmoniously sits in the context of the face, is aesthetically beautiful, and of course, physiologically works well, which means it breathes well and you can smell through it, all of those things that we all expect our nose to do. All right, so I hope that information was very useful. We've taken another deep dive with a set of before and after pictures. And if you have questions about rhinoplasty, we look forward to meeting you and talking about it. Thank you so much.